This is the second annual International Longevity Policy and Governance Summit. I'm Tina Woods. I'm the CEO of Longevity International, wear a few hats, as many of you will no doubt know. We're really pleased to bring everyone together in its second year. Obviously, following from the last summit, you know, the world has gone through tumultuous sort of change as a result of the COVID pandemic. So of course, we are obviously, our whole theme for this year's summit is obviously very reflective of that. And we've titled it, and of course it's during Longevity Week, and of course we have many of our partners here from King's Deep Knowledge Group and Aging Research at King's, you know, here with us today. And our theme is multi-stakeholder global collaboration for health and economic resilience. So that's the broader theme. And so that will be something that we touch upon throughout, and this whole concept around the importance of collaboration. So yes, I'm delighted to hand over the next presentation to Dmitry Kaminsky, the managing partner of the Deep Knowledge Group, who's doing phenomenal work in many different areas, and of course has been incredibly involved looking at what's been taking place in terms of COVID-19, and will be taking us through a global analysis of the economic, societal, and health stability of regions, 200 regions globally. So over to you, Dmitry. Thank you.
Good afternoon, everybody. Thank you, Tina, and thank you, Richard, for your kind words. We at Deep Knowledge Group are very much happy to support this initiative with this conference. We think it is very important. It was extremely efficient for different nations to share their experience and positive examples, how they're implementing progressive solutions in preventive medicine and initiatives regarding health and longevity. However, now, considering this COVID pandemics, this is sharing of positive examples of experience of practical solutions. This is becoming even much more crucial. And now I will share my presentation. One second. So when in March 2020, it became clear that we are facing something unprecedented, really global challenge. We decided to assemble a team of analysts who started to develop big data analytical framework to analyze what different countries and regions are actually doing to prevent the spread of pandemics and to tackle down consequences. And at the first iteration, first analysis was done in April. By the time we analyzed approximately 50 countries using just several tens of parameters, which were considered as major parameters. However, in the most recent assessment, we profiled and analyzed more than 250 countries and regions, literally the entire globe, using 140 parameters. And these parameters multiple different issues somehow related to COVID pandemics, but not particularly only on medical side. And the total, it gives us a big data analytical system with 35,000 data points. And through that, we actually succeeded to derive some interesting patterns. This is the framework. And you actually can consider that to some extent, this kind of like X-ray snapshot of what each country is doing on these issues related to pandemics, and both on quarantine efficiency, monitoring, healthcare system, risk management, government management, emergency preparedness, and so on. We are using mostly data derived from official public available sources such as World Health Organization or World Bank. But on the other hand, we are structuring this data for this big data analytical system. Actually, now it is already analytical dashboard. There's quite a lot of much more advanced solutions implemented just literally over the last several weeks. You can review this dashboard by this link. There is quite a lot of infographics and graphs which are giving opportunity to review this abundance of data, but in a simplified mode, so that responsible decision makers can actually, think about how to implement good, positive examples, solutions at the same time to avoid some mistakes. This work was, well, quite well recognized by world media and by quite big number of government officials, including several ministers and prime ministers. As I mentioned, we're using big data, 140 parameters, and multiple times we were asked such question: what is the solution? What each country shall do to prevent pandemic? So what each country shall do, to cope with consequences, with economical consequences? And the answer is that there is no magical solution. In reality, what we understood after this several rounds, several iterations of this big data analysis on global scale, that country shall actually implement a good balance of all those 140 parameters. It's impossible that, for example, to apply very strict quarantine just itself, because then it will damage the economy. On the other hand, if the country is not implementing any measures to prevent spread of pandemics, it's actually will damage the economy and the country even more. It can cause even political issues. So more of it, for different countries, it's impossible for one country just to follow one particular example of another country, because each of the countries are quite different, including, for example, in terms of their geographical specifics. For example, for Singapore, there could be no equal measures or patterns equal, for example, for UK, because UK, it's a bigger country, there's one big town, but there's a lot of other geographical distributions. So that's why for different countries, there shall be a unique formula, what in particular they should implement. Along with this project on COVID analytics, we also we profiled most active players in the COVID medtech ecosystem. And we created several infographic mind maps. We did also the same for UK COVID medtech ecosystem. There's quite a lot of companies, scientists, R&D centers. And again, we made infographic mind map. It is interactive. And for these interactions, we think that it's quite interesting and important, because again, some decision makers can understand who is doing what and how these interactions could be optimized, in the sense that this ecosystem, anti-COVID ecosystem, could be accelerated. We also profiled H-Tech UK ecosystem. We think that this is quite important, that probably government and some other organizations shall support further development of this industry. It is quite well developed already in the UK, so there's 500 companies, multiple investors, and a lot of funding bodies. Again, it's became very clear that COVID pandemics are actually affecting most negatively all people. However, these companies providing practical solutions through modern technologies to support those people. And that's why, once again, we think that this particular industry, H-Tech, shall be prioritized more in the UK. Actually, in all other countries, but in the UK, there's a lot of opportunities for this. So here are 3 links by which you can review this, these 3 projects. 1 year ago at this conference, International Longevity Policy and Governance Summit, we presented this analytical report. So it was, again, big data comparison of 50 countries by 200 parameters each, with the idea to derive the best examples and the best strategies, how those countries implementing progressive projects in regards to preventive medicine or healthy longevity initiatives. And we've made several special case studies, for example, longevity in the US, longevity in Gulf region. This is our standard approach to apply a big data analytical framework to derive patterns. And we actually derived quite interesting patterns why some particular nations are actually achieving much better results in terms of not just life expectancy, but healthy life expectancy. And they're shortening the gap between highly and they're shortening daily disabled life years. Leader in the field is Singapore. Hong Kong are also doing quite well. We summarized these findings in this book, Longevity Industry 1.0, which was published 1 month ago. And in that book, quite significant part dedicated to longevity policy and governance. Several days ago, we launched second iteration of that big data analytical project, comparing more than 50 countries. And actually now it is in the form already of an analytical dashboard. You can review this project by this link. And it is using more advanced data science techniques, much more advanced visualization. There are more than 80 graphs, charts. Most of them are interactive. This is technological architecture of the system. So there's a lot of also geographical maps where you can see some particular comparisons and why, let's say, this provides interesting hints why some countries, again, achieving better results in terms of health life expectancy. So as I said, there's quite a lot of information in this dashboard. Many parameters are actually real time, so they're absorbing information from online sources and updating in real time. And this system will be systematically updated, but I will give you now quite interesting conclusions. What we found actually between analysis of COVID pandemics and this progressive healthcare and longevity initiatives in different countries. Because we think that such big data analytical systems actually will give additional opportunities for decision makers to make this shift from treatment to prevention faster, and as an ultimate goal to achieve this shift from precision medicine to precision health. For that big data analytical research on the matter of most progressive countries in terms of implementing technologies and solutions in regards to preventive medicine and initiatives regarding health and longevity. So actually we found that they have several patterns in common. So they are prioritizing preventive medicine. They are making focus on data science in healthcare, implementation of data science for healthcare. Most of them are having efficient GovTech solutions, e-governance. Apparently all of them having quite a lot of activities regarding digital health and artificial intelligence. And at the same time, these countries having all these technologies and projects, they're having much better opportunities to actually implement national health longevity industrial strategies. On the other hand, we, through that big data analytical system on the matter of analysis of COVID pandemics, we actually saw that countries who succeeded by this time to tackle down this challenge the best, they actually, most of them also have the very same patterns. So from our point of view, most progressive countries will be capable to neutralize COVID pandemics. At the same time, most of them will have probably the best resources and basis to implement later on actual national strategies on the matter of health and longevity. And I think today, later we'll hear some very interesting examples from the speakers from United Arab Emirates, Japan, because those countries are actually doing quite well on both fronts. Thank you for your attention.
Thank you so much, Dimitri. As usual, incredibly comprehensive and incredible detailed analysis. We've got a couple of minutes before the next panel, so I'm just going to, we've had a couple of questions come through, and I'll just ask one to you, Dimitri, from Jose Cordera. It asks, which specific rejuvenation technologies do you think will first become commercial? And in 10 years and in 5 and 10 years, what is your prediction?
I think there are already such technologies on the market. I think there is lack of management, understanding what shall be applied and when, and in what capacity. And the key solution, I would say, the game changer will be good enough panels of biomarkers of aging and longevity. I think today we also will hear very comprehensive discussion of that matter. So my point is that there are already technologies capable slightly to rejuvenate your body. If you assemble them like 10 or 20 or 30 of them in one, let's say, blend, so they literally will be capable to rejuvenate at least for several years, or at least definitely to slow down aging. The problem is that doctors do not have yet enough understanding, not enough big data analysis to understand what and when shall be implemented for particular, particular, even not patients, but I would say healthy people, because they may understand maybe a little better what should be applied for unhealthy people. But maybe it should also consider what should be applied for healthy people to extend their health longevity.
Thank you so much, Dimitri. Very, very pleased to have His Excellency Dr. Alamiri from the United Arab Emirates, who is the Assistant Undersecretary for Public Health Policy and Licensing at the Ministry of Health and Prevention. His Excellency Dr. Alamiri, very interested, and of course, he will be presenting a more detailed view of what is happening in the United Arab Emirates. But yes, so very pleased to have you here to give your perspective and perhaps contrast, compare sort of what you've heard in what is taking place in the UK and the USA and your situation. Over to you.
Thank you, Tina. First of all, good evening, ladies and gentlemen. And it's my profound honor to join you here today, talking about the longevity, which is very important for the human being. I'm quite sure that everyone knows that by every decade, there is an increment in number of the years added to the human's life, 2 to 3 years. But this probably could happen only in the countries which they have sustainable health programs, sustainable policies to support the human's health. I will just shortly share with you just 3 main pillars which it supports the longevity in United Arab Emirates. On the top of it is the public awareness. We are really concentrating on enhancing the public awareness program to make sure that our community, which we have almost close to 200 nationalities, will be able to have the healthy lifestyle and to avoid like a junk food, avoid the smoke, avoid obesity, hypertension, cardiovascular diseases. The healthy lifestyle could be not only with the I can say middle or the aged people, but our main target is the young generation, that a lot of policies, programs being implemented among the students at school, the governmental and the private schools. And we concentrated on them since more than 15 to, I can say, 18 years, that to give them a proper public awareness. And those are the future of our country, and how to allow them to learn about the healthy lifestyle and to protect them from the cardiovascular disease, from different type of the diseases, the either communicable or non-communicable diseases. And this will allow them to be healthiest generation at the future, and to support their that implementation of the best policies, that those policies will allow you in predicting different type of diseases, policies to minimize the number of the cancer cases, the policies how to minimize the number of the prevalence of obesity, the prevalence of the smoke, any programs supported by the governments that to make sure that we will be able to see bad behaviors. Despite that, this helps the people to be aware of their health while they are at home, their office, and they will be connected through the internet with their family medicine doctor, with their hospitals, with their clinics, that we will be able to predict any sort of complication that it could happen to them. And this will lead me to go to the third pillar, which is the prediction of disease programs, which is being implemented in my country. I will share with you two examples. Now, one of the examples that this has been adopted, a program in the Al-Qasimi Maternity and Children's Hospital, that we have a technology which, had a strategic partnership with the Children's Hospital in the United States of America in Chicago, that we will be able, after the birth of that baby, to be able to predict a sort of the hereditary diseases that it could, could lead to the death of the baby, and we will be able to protect his life and provide them with some sort of medication. Despite that, the other prediction programs, some of the programs being implemented, that we do the blood test and we will be able to predict any sort of illnesses that it could happen to that person, and we will be able to protect them and to make sure that we will protect his health, and this will allow the longevity in our country. And therefore, on top of what I have been said, the government of United Arab Emirates for the last 4 years decided to change the name of our ministry from Ministry of Health to Ministry of Health and Prevention, that by prevention, we will be able to predict those diseases and protect the human's life and allow them to have a healthy lifestyle, and this will support the longevity in our country.
Fantastic. Just turning for a final comment to Dr. Al-Amiri, in terms of how you're harnessing AI and data, we often hear, obviously the Middle Eastern countries are very, very advanced in this respect, in terms of the prevention focus of your country. Oh, you're on mute.
Yes, thank you, Tina. That's a good question. In terms of prevention, I will just share with you just 3 small examples. One of it is that we added a sort of educational program at the curriculum of the schools with the Ministry of Education, that we will be able having the sort of preventional steps to protect them. Despite that, we had a strategic partnership with the road and transport authorities, with the municipalities, with different local emirates, that to provide the community with the walking and biking areas that it has to be accessible to everyone, and to allow everyone to exercise. Despite that, the programs which was launched but with different emirates, but I will share with you one of the examples, the Dubai Fitness Challenge, which was launched in 2017, which encourages everyone who is a resident in Dubai or other emirates to comply 30 minutes of activity each day for 30 days, and this will be watched by the AI. It's artificial intelligence that you could load it in your mobile application, and it controls you and makes sure or assures the auditors that to give them an evidence that you exercised for 30 minutes every day, and then that will be graded. Those were sort of encouragements, and I can say tools which it was used to prevent the I can say either the communicable, the non-communicable diseases, and this to support the community anyway.
His Excellency Dr. Al-Amiri, who will give us a more detailed view on the Middle Eastern situation from his perspective, the United Arab Emirates perspective. Thank you so much. Over to you.
Thank you, Tina. Once again, welcome to everyone, and allow me to share with you a short presentation. I'm quite sure the presentation is clear to everyone, Tina?
Yes, it is. Perfect.
Once again, I would love to share with you a sort of reflection of legacy from the COVID-19 and healthy longevity, which was experienced in United Arab Emirates. My colleagues from Japan were saying that you need strong policies, you need strong facilities to deal with, but I can say before that you need strong leaders to have a vision to support your healthcare system and to support your main entire I can say country to in fact to enable you in having the successful policies, legislations, implementation of technologies that allows you for the success in your system and in your policy. And therefore, here comes what our leaders believes, that human being, their ideas, innovations, dreams, and connections are the capital of the future. Wherever they go, tomorrow will for sure good things happen to the place which they be there, and they share with the government or with different sectors with their ideas and with innovations. And this is the statement of His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President, Prime Minister, ruler of Dubai. And here came the importance of the investment on the main capital of the country, the citizens, the development of the, I can say, the country by putting our investment on the citizens, on the human being. And therefore, this is a statement of His Highness Sheikh Mohammed bin Zayed Al Nahyan, the Crown Prince of Abu Dhabi. This, in fact, for sure will take us in supporting our healthcare services. And this led to the swift rise of the healthcare sector in UAE. And there were a number of pillars that led this rise. I'm on the left side, I can share with you some of those pillars are like the vision of the government to have a class healthcare system, the best class of healthcare system, the growing and aging population. Today we are talking about the longevity, and here the aging population is sort of putting a demand and a pressure on the healthcare services, increased burden of non-communicable diseases, and how we will be able to reduce the prevalence of those non-communicable diseases such as diabetes, hypertension, and the rest of it. Greater expectation of the community. The more, the higher educated people you have in your country, the bigger or the higher expectation of them will be for the healthcare services, expanding medical tourism, and then the international healthcare services, which they are having the base in our country. And this led that the healthcare investment to rise up from 56 billion UAE dirhams in 2019, which is forecasted to reach 89 by 2024. And in fact, we tried to invest on a certain number of the national agenda to minimize different type of non-communicable diseases, which supports the longevity in UAE. And this is a part, I'm happy to share with you, a part of the national agenda of UAE, that how we will be able to minimize the prevalence of the obesity among the children, minimizing the number of the smoking people among male, female, and also the minimizing the number of deaths from the cancer per 100,000 population, and the minimizing the number of the deaths from the cardiovascular disease per 100 million population. And on the top of it, which is being marked on red color, the average of healthy life expectancy. This was implemented since 2014, and now we are trying to reach the higher number, which we reached 66.7 for the year 2019. But the government had emphasized on the national agenda and has been emphasized on minimizing the cardiovascular and the related to the cardiovascular disease by implementing the healthy lifestyle to make sure that we will be able to minimize the prevalence of such non-communicable diseases and even the communicable diseases, and to raise the public awareness and to implement the healthy lifestyle with the total population at the entire country, and mainly with the youth, with the young generation. But this needs to this will not support you unless if you have the proper implementation of different type of policies, the policies which controls like the policy which controls the communicable diseases, the policy which supports the intellectual property in the field of the healthcare, the policy for the promotion of the mental health. And mental health now is being provided at each single health center and the clinics and the hospitals all over the country, and also the policy for proper and 100% immunization of the inhabitants of United Arab Emirates. And those policies are being updated year by year. And this is this slide will show you the example of how we will be able, since 2017 until this year, for the last 4 years, to update almost 36 number of different laws, regulations, and the policies which it supports the healthcare sector and the healthcare indicators in United Arab Emirates. And this led to a success in rising the life expectancy at birth up to 79.8 in 2018, and the healthy life expectancy at birth, in fact, to 66.7. This is a good evidence and an example that the average of life expectancy is being increasing since 2000 until 2018. This is the report, but we have also the reports until today. But also to minimize the cases of death per 100,000 population, if you will look into the left side at the bottom, the death from the communicable diseases, it was 36 in 2000, the prevalent, 36 per 100,000 population in 2014, and now we are only 13.7. Death from the injuries, it was 32, now 11.7, and death from NCDs, non-communicable diseases, it was 547, and now we are almost one quarter of it, which is 106. Let me share with you some other indicators like the smoking, the prevalence of the smoking in our country, where 11% of the total population in 2010, and we are just by end of 2018, we reached to 9%. And we were able also to minimize the percentage of the obese people from 37% to 28% in 2018. And also the diabetes, which is one of the leading factor for cardiovascular disease, from 19% to only 12%. But the effort is being taken to go further and minimize more. For sure, I'm quite sure that the COVID-19 pandemic came as a shock to different governments, to healthcare system, and also affected the economics worldwide. And for the first time at the history that the health crisis shut down the entire global economy, and it was so painful, and also affected the healthcare services. And really, we were able to protect our community and to provide them with different sort of measures, those measures that allowed the people to be away from the hospitals and the clinics, and to provide them with the healthcare services while they're at home or they are at offices. And this is the legislation which allows us for implementation of this distance treatment programs, telemedicine, and also this was for the community protection. And despite that, there are many. Those are only, some of the examples, 8 examples that I'm trying to share it with you, how we were able to also monitor the supply chain to provide all the people, especially the patients with the chronic disease, with their medications without any complications that they can face while they didn't have an access during the lockdown to go to the hospitals. All the medications used to reach to their door to door to their house, and even the visits of the physicians and the nurses to their house, and to provide them with the needed healthcare services. The implementation of new innovations in R&D by using the stem cells, the plasma of the donors, and the new technologies, which this was a part of it, that we started to do the genome sequencing, despite the usage of the stem cells for treatment of the COVID-19 positive patients, the using of the plasma from the recovered patients, and also the implementation of clinical trial phase 3 for inactivated SARS-CoV-19 virus, this vaccine with Sinopharm, and now we started to vaccine also the frontline, which we are, this is my photo that I'm taking the vaccine, and also the implementation of the AI, the artificial intelligence. This small vehicle is being monitored through the distance by the computer system, and used to go and reach each single house or a villa to provide the medications, the PPEs, the sanitizers to the people, and to help them and provide them with the quality of care and with medications, and not to allow anyone to suffer. The usage of the drones for the disinfection programs, and the mobile applications for the communication between the people, the people with their physicians, and also the telemedicine, which we were able to cover the entire United Arab Emirates with the proper counseling, treatment, medications, and also the support to them by some of the new innovative ideas. And I will conclude my presentation in showing this slide as a statement from His Highness Sheikh Mohammed bin Rashid Al Maktoum, that innovation is what defines our status among nations and the value we add to the world around us, which it means that even during the pandemic situation, we were able, by implementation of the most innovative ideas, new innovations, new technologies, Internet of Things, and AI, to serve our community and to provide them with the highest quality of care. And this, for sure, it supports the longevity, and it supports the healthy lifestyle to be properly implemented with our community in United Arab Emirates. Thank you very much, and it was my honor and pleasure to join this conference with you.
It was our honor and privilege to have you involved, and thank you so much for an excellent presentation and the focus on prevention, the role of innovation, and how you've tackled so much. It's quite incredible.